My interest is in sports medicine. I'm a sports medicine physician, and when people say what you do sports medicine, you just think of athletes, but it's not necessarily just athletes. It's the whole realm from little Johnny falling off the jungle gym and breaking his arm to someone with bad arthritis of the hip or knee. So it's the whole spectrum. It's not necessarily just people that are in athletics. It's also the weekend warrior, or just someone that's around the house that hurt themselves raking the leaves. My name is David Gealt. I'm a sports medicine physician at Cooper University Healthcare. I have a position as the assistant director of sports medicine and the director of the sports concussion program. Being an athlete, and you can talk what the sport is, or you can give their vernacular as far as what positions they may be in, or how the injury is, or what kind of play they had, or even just talking about the game last weekend. It gives them sort of the same level field, I guess, and they feel a lot more comfortable. They let their guard down a little bit, and then also I can see when they do go back, if they're having problems with their mechanics or if they're having issues, we can touch on that and make sure that they fix that problem so that they don't have this recurrent injury. I have a vested interest in concussion management. That's what I do a lot of, especially in sports. And there's a great trend or paradigm shift that we just did just a few years ago. We used to treat people a completely different way that we're doing now, because we're finding with research that we've been doing, there's changes, and it's been helpful. Besides treating the patient or the athlete on the field, or have them coming into the office, we do a lot of education, and it's very important to educate not only the patients and the athletes, but also the parents and the trainers and the coaches. Particularly in concussion management, we've enacted policies for each school. There's now guidelines that you have to follow. So we want to make sure that they're up to date on all the management and proper training that they need to have, so that they can make sure that the athlete is safe and is able to play in a safe but productive manner.